Coverage on Family and Consumer Sciences Day. We're so pleased to have Dr. Ingrid Adams. She's the Associate Extension Professor at the University of Kentucky. And I'd like if you could just share a little bit about yourself and your background.
Thank you, Gwen.
Sure.
I have a PhD in Nutritional Sciences and Family and Consumer Sciences Education from Iowa State University. I'm a registered and licensed dietitian and a licensed diabetes educator. My research interests are in behavior change methods, specifically critical thinking, and in health disparity. I'm a Robert Wood Johnson grantee, and I serve as chair for the American Association of Family and Consumer Sciences Obesity Prevention Community and chair-elect for the Academy of Nutrition and Dietetics Nutrition Education for the Public Dietary Practice Group.
Wow, so that must all keep you very busy.
But it's quite enjoyable.
It's a passion.
Enjoyable.
Well, with your background, you seem like the perfect person to talk with us about trends in childhood obesity and what methods you think would be most effective for reducing obesity in children.
Yeah. Well, recent data show that childhood obesity rates have stabilized in the past decade.
Well, that's good.
And data also reveal a downward trend in obesity rates among young children from low-income families in many states. This is definitely good news. However, we still need to remember that childhood obesity prevalence remains very high. Approximately 12% or 12.7 million of our children,
wow,
young children, are obese. And there are significant racial and age disparities in obesity prevalence among children and adolescents. So work is not done. We have to keep pressing forward, and we have to keep working for a better future for our children.
Yes, those are very good statistics to have, and it shows we have a lot more work to do. So then, what do you think are the best ways to help reduce childhood obesity? I know that that's probably not, a simple answer, but...
And you're right, there's definitely no simple answer, because we all have to begin by acknowledging that obesity is a multifaceted public health problem with biological, behavioral, and environmental triggers. So there's no one right approach, there's no magic bullet, there's no elixir that can fix this whole obesity epidemic. However, the 2012 Institute of Medicine's report, Accelerating Progress in Obesity Prevention, provides excellent guidance. That report recommends a cross-sector engagement and action across the physical environment, the food and beverage environment, the message environment, the healthcare and work environment, and the school environment. And when we talk about the school environment, I think this is an area where FCS, Family and Consumer Sciences, could play, first of all, they play an important role and could continue to play an important role in terms of providing the skills that students need to make healthy lifestyle choices in the area of nutrition and physical activity. So when we look at this whole obesity problem, we can definitely see that there's no simple solution. And in my opinion, I think every state needs to work with individuals, families, communities, childcare settings, government agencies, the medical care providers, faith-based institutions, the food and beverage industry,
yes,
and even the entertainment industry, so that we can work across sectors and we can encourage healthy eating and healthy lifestyle behavior. I think it's everyone coming together to create that culture of wellness where healthy choices and even physical activity is accessible, and in the area of food, affordable for everyone. So if I were to sum this up, I think it's everyone's everyone has a part to play in terms of the obesity epidemic. We all need to take ownership, and we all need to work together. So collaboration is key.
I think that's a great summary of the situation, that everyone can play a part in helping to, reduce obesity and keeping it, top of mind, and everyone making it a priority.
Definitely, definitely.
Now, through your, research and volunteer efforts, you've really focused on improving, the health of, children and families. What have you found to be the most influential factors in children's food choices?
Excellent question. And as with everything else, there are many factors that determine children's food choices. But in terms of my research and what I have seen and what I've even experienced as a parent,
yes,
in terms of raising my own children, I have found that parents are the most influential in terms of determining a child's food choice. And most of the research shows that parents are the ones. They're the gatekeepers in the home, and they are definitely the ones that tend to limit the choices that children have. So what I really suggest in this area is that parents try to remain open, and offer a wide range of choices, and try not to limit the experiences that their children have. I remember in one of our interventions to increase specific vegetables and the more nutrient dense ones, like dark green leafy vegetables, yellow orange vegetables, and cruciferous vegetables, we had a food demonstration. And at the start of the demonstration, we were making pumpkin smoothie that day. And at the beginning of the demonstration, a parent immediately said, when she heard the recipe, she said, "Oh, my child would not drink that. My child would not have that." And after we were finished with the preparation, the child actually had a taste and asked for seconds. So generally what we find is that parents have these preconceived ideas and notions that maybe my child would not like this, and maybe because of their own preferences, and they tend to limit the choices of their children. But parents have an important role to play, and they need to be open, and they need to have a wide range of foods in the home so that children can have good experiences and develop healthy practices.
Now, those are great suggestions, and not only can family consumer sciences play an important role, but also parents. So this is great, for everyone who's watching, that we can all, play a role. And I think we've somewhat covered this about, simple things that parents can do, to encourage healthy eating. Are there any other things you can do? Let's say if you do have a picky eater or something, you're very open, but yet your child, seems like they don't want to try things. Are do you have any other suggestions?
Yes, and I think you raised an important question, Gwen, because we don't all have perfect children. And, we all parents would say there's no perfect child.
No.
Most of the time, or generally. And I think you raised the guidance I generally give to parents is that start by being a positive role model, and start by eating a variety of foods, a variety of fruits and vegetables, and also provide nutrient-dense food in the house that can be used as snacks, and that can be used as just choices that children can make. I also suggest in that area that parents start introducing healthy foods at a very young age, so that children start learning how to make healthy choices. Another thing that parents can do is to try to establish family meal time. That is so important in terms of the all-round nutritional health of a family. And research is so clear about the benefits of family meal time. When children take part in scheduled and regular family meal time, they tend to have, definitely better nutrition. They definitely develop healthier eating habits. They are more likely to be a normal weight, and they do better in school academically. So it's really important that parents try to establish this time. And mealtime is not really this huge time where you put out this 4-course meal, but it's really trying to provide simple things, a fruit, a vegetable, and lean protein, some whole grains, and you make that together in a way that it's culturally appropriate for your family. Also, I would suggest that mealtime should be enjoyable, and you mentioned the picky eater.
Oh, yeah.
And that's not a time to fight with children. We should allow children to have choices. If you have a picky eater, maybe provide different choices so that child can really choose. Also, I have found with picky eaters that you introduce foods slowly.
Okay.
And just know that generally for a child to accept a food, it takes about offering that food about 9 to 10 times. So many times parents give up too quickly and too easily. And I always say there are also tricks of the trade. Your child may not like spinach, but they may not be able to distinguish the taste of the spinach in spaghetti sauce. So there are ways to really still get the benefits of healthy, to get children to make healthy choices and to eat in a healthy way, even if they don't see what they are eating in front of them. Children generally like raw vegetables. I found with my children, when they were growing up, they would always say, "Mom, we prefer our vegetables raw." So children generally like raw vegetables. I always serve a raw and a cooked vegetable. They gravitated towards the raw.
I've had the same experience too. Well, they would request the raw vegetables, so that I have a 3-year-old and a 6-year-old, so that rings true for me too.
Yes,
very helpful tips, very helpful strategies.
And another thing that I want to touch on briefly is that parents need to be careful with the beverage choices for children. Because there's so many times that children consume, and families and individuals consume so many calories just by the things we drink. So monitoring and providing healthy beverage choices for your children is equally important.
Good point. That's a very good point. And now you had mentioned, the critical thinking model that you had worked on, developed that, and could you tell us about this model and how it's used in nutrition settings?
Yes. Well, the critical thinking model provides opportunities for individuals and families to analyze and to evaluate information, situations, and their behavior in order to make fully informed nutrition and physical activity decisions. Reflection, the model that I created, reflection on thought processes and action is an integral part of the model. So individuals are provided with sound nutrition information that serves as a stimulus, because many times individuals lack the knowledge on a topic to making it difficult for them to act. So there's that aspect of providing sound nutrition information that would serve as a stimulus. Individuals are also there's also empowerment. This is built into the model because it increases a person's capacity to define and analyze and act on his or her own problem. The philosophical underpinnings of empowerment suggest that individuals have valid and essential knowledge of their own needs, values, and goals, and as a result, they possess the strength and competencies to solve their own problems. And many times we fail to give people the opportunity, and we fail to empower them with the skills to solve their own problems. So empowerment is an important part of the model, also problem solving, goal setting, and building self-efficacy skills. Building that knowledge or just that feeling that, yes, this is a problem that I can handle, I can fix this, I can work with this. And in our research, what we have used in the area of self-efficacy is that we've provided recipes. We've allowed parents to prepare recipes related to vegetables, related to whole grains, or whichever area we're working on, so that they develop skills in that area. And we also provide, as I mentioned before, opportunity at each stage for parents to reflect on their behavior. So in essence, the critical thinking model provides the tools for reasoning and problem solving so that individuals and families can make the most informed decision.
Yes, people, if they don't have the tools, it's true, how can you expect them to succeed in that area? So I think that's excellent.
Definitely. And I just want one other point, Gwen. I know we focus a lot on nutrition, but I need to emphasize that physical activity is just as important, equally important. And even as parents and as families, as we begin to think about providing what is best for our children in the area of nutrition, physical activity goes hand in hand, and we need to ensure that our children get 1 hour of physical activity each day, and 1 hour, however your family choose to incorporate this 1 hour. It could be on a walk, it could be playing family, walking together, basketball, whatever, dancing.
My kids like that, yeah.
Yes, equally important is that area of physical activity.
And that's a very good point too, that those two things really go together, that you need to balance them.
Definitely.
Excellent. Well, we really appreciate all the knowledge you've shared with us, all the tools, and we hope that you have a wonderful Family and Consumer Sciences Day. Are you dining in tonight?
Definitely dining in. I am excited about what we can do in Family and Consumer Sciences education. Excellent. And how we are using family mealtime. And there's so much strong research behind this area to make a change and to improve the health of our families. So I'm excited to dine in tonight, and I hope everyone enjoys that time and enjoy your meal this evening, and happy Family and Consumer Sciences Day to everyone.
Thank you, Ingrid. And I also just wanted to update everyone on our commitment numbers. So we're at 99,924 commitments. So we just need, is that 56, if I do my math correctly?
Yes.
56 more commitments to dining in to break 100,000. So that would be wonderful. So hopefully by the next time we do an interview, we can report that we have broken it.
Yes. So we're all going to head to Facebook and Twitter and our social media, and we're going to encourage people to commit.
Exactly. Maybe we'll even by tonight hit our 200,000 goal. It's possible.
Yes.
It's possible.
Yes.
Okay. Well, thank you so much, Ingrid. I've enjoyed talking with you.
Thank you, Gwen. It's been my pleasure, and happy Family and Consumer Sciences Day to you and everyone.
Oh, thank you.
Thank
Bye-bye.
you. Bye-bye.